Good morning, good afternoon, and good evening. My name is Berta Malici, and I work for WHO Geneva for the Department of Maternal, Newborn, Child, Adolescent Health and Aging. And I lead the Secretariat of the Network for Improving Quality of Care for Maternal, Newborn, and Child Health. Welcome in today's sixth webinar in the series of engaging with private sector to deliver quality care for maternal, newborn, and child health. Today, we have the privilege to have three distinctive speakers from Nigeria, WHO, headquarters and country office, who will share with us the lessons learned from Nigeria during the process of implementing their engagement of the private sector to deliver quality of care in health services. Next slide, please. First, we will hear from Ms. Anna Kokotsa, who will give us an overview of WHO's strategy on engaging private sector for service delivery. And then with that framework in mind, we will start to listen from Dr. Rukaire, Director and Head of Nutrition Division in the Federal Ministry of Health, Nigeria. Dr. Rukaire will share with us lessons from engaging the private sector in delivering quality maternal and newborn health services in Nigeria. These two presentations will be followed by a 30 minutes questions and answers session with a panel in which the two first distinguished presenters, Ms. Kokotsa and Dr. Rukaire, will be part of this panel, and they will join by Dr. Ojo, who is a medical officer in WHO Country Office, Nigeria. With this in mind, I would like to hand it now over to Dr. Rukaire for her introduction and presentation of Nigeria's experience and lessons learned from engaging the private sector in delivering quality maternal and newborn health services. Oh, Ms. Anna Kokotsa, sorry, Ms. Anna Kokotsa on the overview of WHO strategic objectives. Anna, over to you.
Thank you, Berta. Good morning, good afternoon, and good evening, everyone. And a special thanks to the organizer for this remarkable meeting on a topic on which the team I have the honor to be part of is working since many years now. I'm Anna Kokotsa, and I'm a technical officer working in the Health System Governance and Financing Department. And I'm here today speaking on behalf of David Clark, who asked me to send these regrets to you all as he couldn't be part of this webinar due to a last-minute conflicting event. So I want today to walk you through the work that WHO, through David's team, has done for 3 years now to take a more strategic approach to provide technical support to countries in engaging with the private sector in health. And why we have done this? Because WHO and partners at the global, regional, and local level recognize that the private sector is an incredible and prominent provider of health service delivery, particularly in Africa, where it delivers more than 40% of all healthcare services. And before moving forward, I just would like to specify that what we mean by speaking about the private sector at WHO is all the non-governmental entities, so both for-profit and non-for-profit actors. Next slide, please. So 2 years ago, at the behest of Peter Salama, the former, we set up a WHO advisory group on the governance of the private sector for universal health coverage. And the group came up with a strategy document about how WHO should support countries working with the private sector. Next slide, please. Within the strategy, the advisory group formulated 6 governance behaviors to empower countries working with the private sector and achieve universal health coverage through an inclusive governance of the public and private actors. These 6 governance behaviors are reported here, and namely they are building understanding, align structures, foster relations, deliver strategy, nurture trust, and enable stakeholders. And this strategy also identified a need for WHO to align global, regional, and local partners working in this area and build governance capacity at the country level to make and implement public policy about the role of the private sector in health. Next slide, please. But the problem is that many countries are still reluctant or are facing several challenges in working with the private sector in a way that is consistent with universal health coverage principles of accessibility, equity, and financial protection. While on the other hand, as I said before, it became clear, even amidst the pandemic, that the private sector has an important role to play in the health system, but it needs to be properly regulated and included in the system for it to behave in accordance with national health principles. Next slide, please. And it was actually to highlight how during the COVID-19, the private sector has supported the public sector in the fight against the pandemic, bringing resources, skills, and capacities to maximize the national responses, that WHO Director General Dr. Tedros, on the occasion of the Africa Debate 2021, encouraged a change in mindset across the healthcare value chain, asking member states to position the private sector as a co-investor and partner in healthcare system. So with all this in mind, about 6 months ago now, we set up a country connector on private sector in health. The idea behind this country connector is to create a platform to convene and coordinate work between countries and across partners in relation to how we work with the private sector, which has always been a blind spot in global health agenda so far. And the aim is really to get a stronger global coordination and accountability to improve delivery for better health outcomes. Next slide, please. And we aim for the activities of the country connector to result in a shared understanding of technical support to countries on effective governance of the health system as a whole, in an increased awareness on the need to effectively integrate the private health sector in the health system, in an improved global coordination of programs and activities directed towards health system strengthening, and finally, in a routine sharing of information, in particularly setting a standing annual forum to review and share experience and catalyze actions on private sector engagement for universal health coverage. Next slide, please. So we want the country connector to be country-driven and country-led. And it's so fascinating today to hearing from Nigeria lessons learned, because our primary audience is at the country level. While at the secondary audience, we are targeting global and regional partners that have already worked or are starting working on supporting countries harnessing the private sector in health. Next slide, please. So within the country connector, we have 6 running key activities, as we realized it was key to support countries through a tool repository of all the published guidance on engaging the private sector in health, through a clearinghouse of information where we want to collect real-time news on how countries are engaging with the private sector, through a support desk where countries can raise their questions and receive practical and high-skilled responses on issues related with engagement with the private sector, an online training course on the topic, setting up also technical working groups to address hot topic in the agenda of private sector engagement. And just as Lerta will note, we have currently a running working group on maternal, newborn, and child health that is creating a great platform for regional, country, and global actors to align and collaborate on assisting countries in working with the private sector to deliver MNCH care. And finally, we have a research stream to fill the big literature gap that we identified on the topic of multi-sectoral collaboration for universal health coverage. Next slide, please. And I will just conclude now saying that a dedicated website has been launched as a front end to call for countries actively participate in shaping the agenda of private sector engagement. And I'm really eager to collaborate with countries like Nigeria, who show that governments can really benefit from reorient their outlook to one of knowledge exchange and co-creation with the private sector as a means to build a stronger health system. Thank you very much.
Thank you very much, Anna, and sorry for omitting your first introduction. So with this information, I would like to hand it over to Dr. Okaire, Director and Head of Nutrition Division in the Federal Ministry of Health, Nigeria. Dr. Okare has led the process of discussion, analysis, and deliberations with the private sector and their involvement in delivering quality health services. So Dr. Okare would like to learn from your lessons and your wisdom so we can inform this area of work and its development for WHO, but most importantly for the other countries. Over to you.
Thank you, Bleta, and I wish to say good day to all participants here, and also to use this opportunity to appreciate WHO, the Advisory Working Group, for the guidance provided and the opportunity to be part of this exploratory study that's aimed at moving us forward in private sector engagement for quality maternal, newborn, and child health services delivery in Nigeria towards achievement of universal health coverage. Next slide, please. And so I also like to state that Nigeria, being one of the quality, equity, and dignity quality of care network countries, 1 out of 11 were involved. We were very happy to be involved in this study. And we started out, and we are going to share our experiences. It was a work done collaboratively between WHO and the Federal Ministry of Health. And we are happy that we are one of the countries that were able to generate evidence that we helped the WHO, as usual, to come up with solutions for health system strengthening. And so I'm going to be talking about speaking to the process of developing the private sector engagement, situation analysis, and policy dialogue that held in Nigeria, the findings from the situation analysis, and then the recommendations that were validated and finalized from the multi-stakeholder policy dialogue, and dwell a bit on the reflections. What do these processes and recommendations mean for the private sector and the public sector in Nigeria? And then the next steps. Next slide, please. Now, speaking to the process of developing the private sector situational analysis and policy dialogue, can we go to the next slide, please? We were guided by the Global WHO Advisory Working Group, who had done a lot of work in providing the guidance needed. They had developed the logical framework around which all the interventions were streamlined, and also giving us adequate technical guidance, and in addition to the analysis and reporting process, and also at various stages of the intervention. We can see from the table on the screen that even they developed, built on the existing knowledge and resources, did the horizon scanning and adaptation, and brought out the key informations upon which countries were guided, including Nigeria, amongst Ghana and Bangladesh, to be able to carry out this exploratory study. And at the country level, WHO worked together with the Federal Ministry of Health and with partners, and through engagement of the National Quality of Care Technical Working Group, we were able to do the stakeholder assessment and mapping from that with their inputs, and then we went on to do a situation analysis, which comprised of literature review and key informant interviews. And through that process, we were able to come up with our recommendations and our lessons learned, and all this were validated even at the multi-stakeholder dialogue that was heard finally before the conclusion of the whole study. I'd like to move on to the next slide now. The process was quite engaging for us in the Federal Ministry of Health. It was a time of capacity building, it was a time of learning, it was a time of interaction, it was a time of learning, coming to know what exactly is the situation with private sector healthcare delivery in the country. And it gave us the opportunity to put our heads together and begin to think through it. How do we move forward? How do we ensure that the private sector is brought on board? Because it became obvious to us from the study that to achieve universal health coverage, both private sector and the public sector must work together effectively to achieve the targeted goals. And so the timeline for this Nigerian project was from December 2019 to July 2021. And we first started, like I said earlier, we established, there was already an existing quality of care technical working group, which we leveraged on to form a sub TWG that worked particularly on this exploratory study with Federal Ministry of Health leading the whole process. And it was an opportunity where all stakeholders had a free say, and we were able to leverage on all the knowledge and expertise in the group to improve what we were doing. And the research protocol also was developed, and ethical review was requested for both from WHO and from the National Health Research Ethics Committee in Nigeria. And this was granted, it was approved. And all the conduct of the exploratory study were in line with the research protocol. And then the next step was to do the situational analysis. And this was conducted through desk review of existing documents, both published and gray literature, and several reports and analysis that existed. And this was augmented with findings from the key informant interviews of stakeholders who were drawn from Nigeria, I would say, but we had to go to the field in the north and the south of Nigeria and went to Lagos. We took Kano and then Abuja and also Imo. These were areas where they already had experiences. They had functional public-private practice mechanisms ongoing. And so they had a lot of experience that we could learn from and they could share with us. And it really proved quite helpful. And subsequently, after gathering information from these two sources, the literature review and the key informant interviews, which were aligned with the study protocol, we went ahead to develop the draft situation analysis, and we were able to synthesize the initial findings upon which the recommendations were based. And this was subsequently validated at the TWG and at the Federal Ministry of Health level, and also the multi-stakeholder policy dialogue section that took place in Nigeria. And finally, we were able to come up, we are going to come up with the report dissemination, the case study for peer review publication. Next slide, please. And this is the logic framework along which we aligned. This was also part of the guidance we got from the WHO advisory working group with the inputs, the outputs, the outcomes, and the impacts. So it was around this logical framework that we worked. It guided us. Particularly for the inputs, we looked at the policies, the strategies, the plans, all related with reference to maternal newborn healthcare. And again, the regulatory functions and framework, whether any that were existing, are they functional? All these were explored through the key in-depth interviews vis-a-vis the quality of care being rendered by the private sector. One also very important area that we looked at is the governance and leadership, the stewardship of the private sector in the national health system, and also the resources, human resources, financial resources, and all that, all this were looked into. And as we got our information, our data, and even in analysis, we also analyzed the findings from our study around the logic framework. Next slide, please. And this slide is just to show us that we have the research protocol to which we can always make reference to. And as I have said earlier, the Federal Ministry of Health and WHO conducted this exploratory study by doing the situational analysis to explore mechanisms that will be effective for ensuring private sector delivery of quality MNH, maternal, newborn, and child services in the country towards reducing the high maternal, newborn, and infant mortality rates in the country. In the past 5 years, there has just been a moderate progress. However, we know that improving quality of care is going to play a very key role in reducing by 50% the mortality rates if adequately and efficiently implemented. Next slide, please. The key findings, the question here is, what were the key findings from the situational analysis? And here we are looking at what were the key findings from the literature review? What were the key findings from the key in-depth interview of stakeholders who were eligible enough to participate as respondents in the key in-depth interview, who had experience and were working in the various sectors that we focused on, which is policy and administration. Those that are working in health service delivery, particularly maternal newborn health service delivery, and those who were working in the area of regulatory function. Those were the key target areas from where we chose our respondents or study participants. And we also ensured that we chose participants who had worked for at least 2 years within that sector. Next slide, please. So from the situational analysis that we have synthesized from the findings, the overview of the private sector in Nigeria, we discovered that we have over 60% of healthcare services delivery in Nigeria being rendered by the private sector. And this is very, very significant. And this played out very highly since inception of COVID, where private sector service delivery with respect to healthcare became very, very important, and the need for it, to deliver quality health services became very, very amplified. And that also goes to show that this intervention is very timely, and it is good that it's coming up and is going to help countries, particularly in Nigeria, to forge the way forward, and has also added to body of existing knowledge. We also found that we have faith-based organizations such as the Christian Health Association of Nigeria, that's predominantly in one of the states in Nigeria, in Imo State. They play a vital role in delivery of health services to underserved populations. And also the private sector in Nigeria also is highly patronized because of easy access, low waiting time, respect by providers. The attitude of health workers from in the private sector are judged to be more friendly, or compared to that of health workers in the public sector. So you find a situation where the populace would rather go to the private sector, especially when they can afford it. By way of impulse, in Nigeria, we have several policies currently existing, which also have integrated within them the private sector engagement components. However, these are very poorly implemented. And in fact, there are also very poor dissemination of these policies, particularly policies, the guidelines, the strategy, all policies documents to the private sector. And if they do not have this document, they do not know what it says, then how can they implement? And also in the area of regulation, in our study, we discovered that the private sector is highly fragmented and poorly regulated. And this were attributed by some respondents to the financial constraints, the human resource constraints to properly monitor and supervise the private sector. And also, few private facilities have patient satisfaction and complaints reporting system. We only found a structured called regulatory framework in Kano and in Lagos State, but so far in the country. And also we were able to report that there's limited capacity of government policymakers in terms of their stewardship and governance to effectively engage the private sector to deliver quality services and have them fully engaged during the process of policy formulation, during the process of policy development. And this is one area where we're going to be making our recommendations that they should be fully integrated and incorporated and carried along as these processes are going on. Next slide, please. On accountability, the private sector do not see the need to share their data with government. This is because they think government does not support them, and they also think they don't have adequate incentives to do so. They are also afraid that some of the data shared may turn against them, for instance, may be used for taxation. And so you find a scenario where there's confusion across the numerous regulatory structures. They are all doing their own thing in silos, and there is no overarching supervision, structural guideline, or guidance, or trying to maintain, make them comply or do what is right, or even enforcement of sanctions. It is very loose, it's very woolly, and there is need for a strengthening of the coordination mechanism for regulation. The private sector also are perceived to be generally good, but quality differ between the urban and the rural. And also some respondents, depending on the type of case, but with respect with maternal newborn health, yes, service delivery is generally good for maternal newborn health, except when it becomes more complicated issues. The private sectors are also highly patronized, like I said earlier, because of easy access, quick reaction time, and also respect accorded them by the healthcare providers. And also the respondents testified to having good rapport between them and the healthcare providers in the private sector when compared to those in the public sector. And so all this go to show why you have up to quite a number of Nigerians patronizing the private sector when they are sick. The market conditions, we find that there is very poor coverage of the national health insurance presently. It is less than 5%, and is mainly for the formal sector. There are so many efforts in country trying to galvanize the non-formal sector through the community health insurance system and all that, but the results have not yet crystallized out. And again, we were able to discover that most respondents from the private sector also complained about the capitation fees that they receive, that is usually very low, and it's not, at times they don't get it on time. And if this is improved on, this could be a way to incentivize the private sector to deliver quality maternal, newborn, and child health services. And also, the delay in reimbursement of this capitation to private sector, as alluded before. And they also reported high attrition rates and poor remuneration. These are the factors that are affecting the market conditions with respect to maternal and newborn health service delivery in the private sector. Next slide, please. So these are some of the statements, the things we were able to come up with from the respondents. The interviews were audio recorded and they were transcribed, and to ensure accuracy and representation. And these were some of the comments. From the hospital manager from this private sector, say we have been collaborating with the NHIS for several years now, but we usually experience challenges dealing with them, especially in terms of delays with their reimbursements and also the fees they pay for capitation, which is quite low, and it is not profitable to us. All these are just to support what has been said earlier on, and also the chairman of one of the private associations says that key policies and strategies which support private sector engagement have been developed by the Federal Ministry of Health and partners, but they have not been adequately implemented over the years. Next slide, please. Still going further with the findings from the situational analysis, we came up with these initial recommendations, which eventually were finalized, and we'll get to the final recommendations towards the end of the presentation. And this says the private sector, both for profit and for non-profit, should be adequately involved in the development of national health policies and implementation strategies. The Federal Ministry of Health should engage the private sector associations much more in all these processes to understand their challenges. We think they should be, it should really be a partnership. We hear them and the government hears them, and they plan together, they own the process together, and they work out the solutions together. Then they can implement together, and then there can be more success in service delivery. The latest healthcare quality standards and guidelines should be disseminated to all private sector to ensure compliance. Yes, what you don't know, you cannot implement. Adequate financial incentives, that's the capitation we spoke to, should be provided to private healthcare providers to deliver as a way of incentivizing them to ensure that they deliver not just healthcare services, but quality healthcare services. The data tools also should be made available to them. Usually due to paucity of funds, you find that most implementing agencies and also particularly the private sector don't even have access to these tools. And when they don't have it, that's one of the reasons they provide for you why they don't submit their data to government. Private, number 6 says we should provide adequate financial and human resources to health regulators to effectively monitor the private sector, and also the need to also incentivize the private sector by providing them with low interest loans and other financial products, gives them waivers and others that will encourage them, because we have to align service delivery also with the profit making avenue. For them, that's the only way we can actually partner effectively with them. And then finally, there should be a dialogue mechanism for public-private partnership. Next slide, please. And finally, I want to speak on the recommendations from the multi-stakeholder policy dialogue. Like we said earlier, after the situational analysis, which we had deduced from both the literature review and the results and the data generated from the key informant interviews, we came up with those draft recommendations, which we took forward to the Federal Ministry of Health and to the multi-stakeholder dialogue and the TWG. And all the stakeholders were able to go through all these findings and review them and critique them and find out, agree on what are the key challenges, what are the solutions, and we're able to make recommendations for the country. And so next slide, please. And so the main objective of the multi-stakeholder dialogue was to review and assess the findings from situational analysis that had been done, and also and propose models for effective engagement of private sector with the public sector, realizing that the two must complement each other for better healthcare delivery in maternal and newborn and child health. And we came up with these key recommendations, which include that there is need to strengthen government capacity to regulate and have oversight function over the public sector, as well as to conduct capacity building for the private sector engagement. It was discovered, like I mentioned in our findings, that there was paucity of, or there was inadequate capacity, both from the administrators, the policy level, in ensuring effective private sector engagement. And also, we also said there should be alignment of structures. Here we mean that there should be proper, the coordination mechanism should be strengthened, like what we saw in Kano and in Lagos, where they have an organization that is dedicated and is able to coordinate and supervise the entire private sector with respect to improving quality of care. And we should also provide adequate health insurance risk capitation for the private sector as a way of encouraging them to deliver quality health service and also make some profit at the end of the day. And there should be stronger and strengthened stakeholder engagement in all the processes in the national health system to ensure that the private sector is adequately integrated. They are one of the non-state actors, that they play their role, and they bring the value addition that they have in terms of capacity, skill, even finances to the health sector for health system strengthening, as well as disseminate health policy strategies and plans to private sector providers. And also there's need to adequately engage private sector in health policy development. I've said that before, and provide data collection tools, the HMIS registers, the tally sheets, and all that to the private sector. Next slide, please. These are just the metrics we used in working during the multi-stakeholder dialogue. This worked on the thematic area 1, policy administrators, all the participants, the stakeholders. We worked in groups and ensured that they identified the key challenges in this thematic area, came up with solutions and recommendations. I won't be reading them because I've already gone through what was what was synthesized out of all this. This is just to show what we actually did. We did this across all the 3 thematic areas. Next slide, please. We adopted the same process. These are along the regulation thematic area. For instance, one of the key challenges is regulatory mechanisms, though available, are not being enforced or well implemented due to poor funding and short human resource to effectively monitor, and all that, and the recommendations. Next slide, please. And yes, the same thing applied to the service delivery thematic area. The same process was used, and this was how we synthesized the recommendations that I just spoke to before. Now, next slide, please. Now, it's time for us to reflect. What does this mean for private sector in Nigeria, and what does our findings and our recommendations mean for the public sector in Nigeria? Next slide, please. For us to move forward, this means that engagement of the private sector is very critical towards achieving universal health coverage goals in Nigeria. The need to create an enabling environment for private sector to thrive and deliver quality maternal and newborn health is a win-win for both government and private stakeholders, because in the end, it adds up to the health of the nation. particularly the mothers and the newborns and the child and children health outcomes with respect to our focus here. The private sector should be engaged as critical players in health policy formulation and implementation. These are key messages we want to take forward in Nigeria to all the necessary stakeholders to begin to work on and go forward with. Then private healthcare associations should be adequately engaged for health regulation going forward. This study has provided that baseline information that will be needed to build on and ensure that the healthcare regulation is the structure and the coordination is well improved. And finally, the private sector requires the right incentives to deliver quality maternal and newborn health services. Next slide, please. I have to rush now. Next slide. Next slide. Okay, thank you. Also, what we have learned from this whole process, from the exploratory study, from the experience, is that in-person technical working group meetings led to smoother implementation than one-on-one meetings as required by COVID restrictions. We also think saw that there's a need for a government champion to drive the entire process. There is a need to strengthen capacity of both government and private sector to implement policies on private sector engagement. Organizations or brokers to provide technical guidance on quality of care for maternal and newborn health service delivery is paramount. And there's need for incentives and financial support to private sectors to improve quality of care. There's inadequate, we should move towards having adequate and well-structured regulatory structures for private sector. This was found to be inadequate all over the country in the states, except for Lagos State and Kano State. Then the benefits to the countries, there were a lot of benefits we got from working together with Ghana and also exchanging ideas from Bangladesh and sharing lessons together. It helped impact what we were doing and gave us clearer vision and direction. And also, we also noted and learned that priorities do change during pandemics. Next slide, please. Thank you very much. We have come to the end of this section of the presentation. I hand over to you, Dr. Bletta. Thank you.
Thank you very much, Dr. Okaire. Thank you for sharing your rich experience in the process and the results, recommendations that you have reached. It is very important to observe some of the data you shared. 60% of maternal newborn health services are provided by the private sector. So for all of us, if we have to work together to deliver on the Sustainable Developmental Goals agenda and achieve its targets, we cannot ignore the service delivery in the private sector. So there is one health system, and that one health system includes both public and private. So the reflections that you shared with us are very important. One of the participants, Sonali Daniel, is saying that the same type of findings that were found in Nigeria would apply to India as well. And we know very well from our colleagues in Ghana and Bangladesh that have implemented a similar process, that their findings are similar too. So we are facing quite an important challenge. And for this challenge, we need to find some solutions, quick solutions, to be implemented in the context of COVID, that we know very well it will not disappear anytime soon. So please, colleagues, start writing your questions in the chat box. We already have a few questions, and I'll start now addressing them mainly to the Nigeria team. And I'd like to invite Dr. Ojo, medical officer from WHO country office, to join us in the panel, as well as Ms. Sanako Kotsa from WHO headquarters, the governance and financing unit, to be part of the same discussion. So, Dr. Ukaira, I'll start with a few very small questions, which none of them is easy, but they are more targeted towards the Nigeria context. So the first question for you, it is in relation to the regulatory framework and regulation. So one colleague is asking, what is the Federal Ministry of Health doing to ensure regulatory framework is available and implemented in all states in Nigeria? Okay, so we'll start with this and then we'll switch into the training.
Okay, thank you very much. Yeah, thank you very much, Dr. Bleta. And thank you. I want to thank the participants for that question. Presently now, I will say that the regulatory framework is something that the government is going to take forward from this study. Begin to go through the process of developing one, and not just developing one, but walking the talk and ensuring that it is actually implemented. Like our study noted, there is poor regulation, there's poor coordination, even from the national level as far as regulation of health services, and including maternal newborn child health services are concerned. And so this is one area that needs to be strengthened, to be worked further on, and ensure that it's implemented going forward. Thank you.
Thank you, Dr. Ukaira. So the next question, or there are a few interrelated questions. One, it is in relation to training. So the trainings that are developed and implemented by the Federal Ministry of Health, or let's say by the public sector, do they reach the MNCH workers in private sector? So is there such an example? And then at the same time, as the health professionals are represented by professional associations, were these professional associations included or represented in the process of the dialogue, and what could be some of their reflections? If yes, what are their reflections?
Yeah, quite a number of them were involved in the dialogue, but quite a number of them too, from SOGON, from Pediatric Association of Nigeria, from Society of Obstetricians and Gynecologists, and even the nursing and midwifery. They are all part of the quality of care technical working group, amidst others. The main issue is that I would say that presently most technical trainings on technical issues are targeted at healthcare workers and in the public sector presently. Many of the private sector is not carried along, and they also alluded to the fact that many of them also in the private sector, they don't have access even to the policy documents. So these are areas that we need to work further on, just like the study findings suggest. But however, Dr. Joe was very closely with us. Dr. Joe, I don't know if you have anything extra or in addition, both to the first question and the second to add. So you can have the floor, please. Thank you.
Thank you, Dr. Ukaira, for a well-delivered presentation. And I agree with your comments. Just to enlighten, especially participants who are not residing in Nigeria, we have the national, which is the federal government. We run a federal system. And we have the states, which are semi-autonomous in health sector generally. And that is also complicated by the private sector, who also are on the side. So the idea now is, how do we now bring them together in terms of regulation, in terms of really supporting them? And what came out very well was that private sector were a little bit weary of more and more regulations. They want incentives and other support, including training, capacity building, financial support to go to them. And they gave us the example of the health insurance scheme that is giving some funding in terms of capitation and procurement of services, and also in a way regulating the quality of services they provided. However, the states are at liberty to set up this regulatory framework or regulatory agencies. But what is clear is there needs to be a move or a push from the central government to have a template for all the states to have these regulatory frameworks in their different states. What we have are regulatory bodies that regulate the professionals, but not in a big sense the services in those hospitals. So that gap was really clear during this study, and we need to do something to fix that. In terms of training of health workers, I think that was very clear. The private sector service delivery people identified as a major incentive to provide quality services. They want the trainings that are being provided to public health, public sector health workers also to go to private sector. And the professional association, I think it was very clear that we are not exploiting or exploring the full potentials of the professional associations in terms of regulating themselves. There needs to be self-regulation that will happen in the professional associations. They should not just be workers' union, but really professional and seek improvement in service delivery in the private sector. They alluded to it also, and I think it's something we need to tactically encourage through these professional associations. Thank you.
Thank you very much, Dr. Okaro. Thank you very much, Dr. Ojo. We have a lot of questions, so now I'm trying to synthesize across them to get the theme. So, and I may not read exactly what the question is, but I'll try to bring them together. So there is a group of questions around information systems and accountability. And if I recall correctly, in one of your findings, it was that one impediment from the private sector was that they felt that they weren't benefiting from the information, they weren't part of the information system. So from the recommendations of the process that you had, what could be some mechanisms for better involvement of private sector in reporting into the information system, their results? Any comment from the two of you?
Thank you. Thank you very much, Bletta. I would say that for now, like the report shows, this accountability mechanism or reporting mechanism, I would say more or less, is not really existing for the private sector. What we have, most of the focus has always been in developing our policies or our docu-tools, our reporting tools for accountability. Accountability have always been focused on the public sector. So, but with this discourse that's going on now, which is bringing this issue and giving it more visibility, and just like we have proposed the recommendation that the private sector should be carried along, should be integrated into the entire national health system, should be brought, should be part of the entire process from planning level, from designing level to implementation level, and let them also come to own the whole system, know that they are part of the national health system, and not see themselves as separate, and let everybody have a rethink and have that mindset that look, both the public and private are part of the, the national health system in effect, and not just in word. and then we can begin to integrate them and to ensure that they are carried along. It's when they are there that they also guide the process to ensure how will it be carried along for effective delivery. And so that discourse needs to begin to happen. I don't know, maybe Dr. Joy, you still have anything to add to what I have said? Over.
I think in the states where they have those regulatory agencies, it's much better. Lagos State, for example, it's impossible for you to renew your annual license if during the year you've not been submitting reports. So it's really, it's working. I think one major step is to set up these regulatory agencies in all the states, and also help them to understand that they are also facilitating, because there's only one health sector. One of the respondents talked about the fact that it seems we have two health sectors running parallel, and it shouldn't be. We have one health sector serving the people of the country at national, at sub-national levels. So we need to make that reality to come out. Some of the respondents, especially service delivery providers, the providing secondary and primary care level, they talked about the fact that for most of the M&E, they are very expansive. There's so much data to be collected, which the public health sector have the capacity to do that because they can have several people employed. But for private sector, money is everything, including human resources for them. So for them to handle the amount of paperwork and the registers that will go with the reporting, there needs to be some incentives in terms of, grants to strengthen them. Having said that, there are a lot of efforts that are being done by the Federal Ministry of Health to put in place simpler measures for the private health sector to be able to report, and several outreaches and interventions that are going on, supported by donors in the country, to ensure that private sector are providing this data. Over.
Thank you very much. We have a lot of questions, so now I'll have only 3 questions. Please try to address them very quickly, otherwise we only have 3 minutes, so 1 minute per question. First question is in relation to findings from the study. They were pertinent at the federal level, and examples were brought from Kano and Lagos states. Have these findings, would these findings apply to the other states? Is there a general interest in the engagement of the private sector for delivering quality MNCH? On the same line, has the National Council on Health and states, have the findings been shared with the National Council of on Health, so the states can ensure a buying in? So this is the first question. The second question is very specific to quality of care. So are there any initiatives or efforts to share the quality of care standards or guidelines and to ensure a standardized assessment of quality of care across public and private sector? And the third one is in relation to primary health care and private sector representativeness in the primary health care. So has the study and your findings covered the primary health care? Perhaps you can share between Dr. O'Carroll, between you and Dr. Ojo.
Okay, Dr. Joy, can handle the first one. If you remember, I don't remember, but I remember the question on the NCH, sharing, disseminating these results, the results of the study to the MCH. I think that will be one of the next steps, because we are on concluding this study and having this webinar. We're going to take it forward and then be able to publish and take forward the findings forward to the NCH, where all the commissioners and of the states usually will be in attendance for their ratification, for both their sensitizing them and also their keying into the recommendations.
Okay, maybe I'll just go on to the standardized assessment. Do I still have time later?
Yes, please take the last 2 minutes.
Yes, so for the standardized assessment, a lot is going on. This is just an expansion or a side work that the National Quality of Care TWG has been doing, and which has focused on the public sector for a very long time. We have quality assessment that has been developed. The Primary Healthcare Development Agency develop a checklist. There is also another one for secondary health facilities that was developed, and we've done baseline. The plan is to continue every year to do these assessments and to continue to support those facilities to improve on the quality of services they are providing. We have some initiatives that will help us to achieve this, including the Basic Health Care Provision Fund that have quality indicators. And we will be supporting government to ensure that it's being assessed. And those are disbursement-linked indicators. If you are improving on your quality indicators, then you continue to access this funding from the federal government of Nigeria. So this study, does it cover the primary health care level? And that's one of the things we also saw. There's the cutoff of facilities or private facilities providing primary only, and secondary is blurred so many times. So most of the private sector health facility hospitals, especially, they're providing primary and secondary services, and that's what we did. And for us, we have clear inclusion criteria. Only facilities that are providing maternal and newborn health services, including labor and delivery. So if a facility is primary and is not providing that, they are not included in the this assessment as much as possible. And then we take most of our responses from health system perspective, rather than, we had some from service delivery and patient groups, but it's more around the health system building blocks. Thank you. I think I'll stop now because of time, but really, I hope we'll have more fora in the country to talk about this more and more. We didn't have enough time in the multi-stakeholder dialogue because this is really a big topic in our country. And I think we'll have more engagements here. So thank you for this opportunity.
Thank you very much. Next slide, please. Dr. Okaro, Dr. Ojo, thank you very much. Anna, thank you very much for your opening. So colleagues, thank you for your attendance. Thank you for the questions. We couldn't answer all the questions. The chat is very busy. So please do log in the community of practice. We'll try to answer most of the questions in the next 2 weeks. Do check out the Private Sector Engagement for Quality of Care series. This was the 6th webinar in the series. Prior to Nigeria, we heard the experience of Ghana. So a thread is being built across these very specific country presentations and experiences which are facing similar challenges, but also are developing innovative solutions. For more information, especially about today's presentation, but also for the tools and the study that is behind, please log into the Quality of Care Network. There is one section on private sector. All the tools are there. You can access, use them, or do contact us if you have questions regarding them. Do connect to the Private Sector Connector website, the WHO UHC Connector. It will be launched on the 7th of December. At the same day, we would like to launch the working group across partners on maternal newborn child health and private sector. So this work will continue in the next few years to come. Therefore, your participation, contribution, thoughts, but also your developments are very important for all of us to push forward this agenda. Join the conversation and do join us in the next webinar that will be in a week's time to discuss another more important topic. Thank you very much. Have a good day and see you soon.
Good day. Thank you. Let's bye. Bye to everyone.
Thank you. Thank you, Dr. Okare. Thank you, Dr. Ojo. Thank you.
Bye.
Thank you so much. Goodbye.